So in terms of today's presentation, I'm really going to look at some of the policy developments in the UK. Yesterday, I spoke a little bit about my organization, so I'm not going to say much about us. We are an African diaspora organization, and what I want to share about our work is that we also do programs not only in the UK, but also in Africa. And I think engaging at different levels, particularly on policy-related issues, is quite strategic. As we see ourselves as a diaspora organization, I think engaging with policy processes in Africa is equally critical for bridging the gap between people here and in Africa. But also particularly at the European level, engaging with players at the European level enables us all to have a voice, and a collective voice and a stronger voice in informing and influencing decision making. I'm going to start with two quotes. And this is a quote in 2002, which was made at the all-party parliamentary hearing in the UK on FGM. And as you can see, FGM is a fundamental human rights issue with adverse health and social implications. It violates the rights of girls and women to bodily integrity and results in perpetuating gender equality. As a result of this all-party parliamentary group, the results or the recommendations included having to review the UK law on female genital mutilation and to introduce policy development that would strengthen work in the UK. This is 2011, and this is from Lynn Featherstone, who is an MP and a Minister for Equalities and overseas champion in violence against women and girls. And the statement was in March, and she said, female genital mutilation is a brutal act of child abuse and a clear form of violence against women. We are all absolutely determined to completely eradicate this practice. Now, this coming from a policymaker and a minister, really for me is extremely important. But the reality is that we do hear that, and it's no different from what we heard in 2000, where FGM was said as a human rights violation. And so this is the context and the backdrop to my discussion on policy development within the UK. The new FGM law of 2003, which came into force in 2004, really was aimed at addressing some of the loopholes in the 1985 law on female genital mutilation. Now, the UK has a specific law on female genital mutilation, and within the policy environment, you either have an existing criminal law which applies to FGM, which is done by some countries, including France, and the specific law is very much focused on FGM. And what we found is that, again, depending on different countries, we tend to see that the specific law does not necessarily make much of a difference. And we feel that a criminal law within existing law tends to have much more weight. And I'll tell you why. With the UK 1985 law, it actually ignored the fact that people could take their children out of the UK to have FGM done. So FGM law at that time applied only to within UK territory. And of course, because it didn't include effective operationalization of that law, it was very difficult to know whether children had been taken out or not. And when child protection cases came out, it was always easy to say, actually, she wasn't done in this country. She was taken out of the country for FGM to be done. How would you know? Whether it's happening in the back streets of Southall, or whether it's happening in Dubai, or whether it's happening in parts of Ghana, you wouldn't really know. So that law in itself was good, but it didn't really make sense in terms of how it was going to be implemented. So the law has been addressed. So the whole issue of extraterritoriality means that you cannot have FGM done either outside the UK or within the UK borders. It increased the penalty from 5 years to 14 years. Now, to date, nobody has been prosecuted on the FGM law. So increasing the penalty from 5 years to 14 years, I don't know how effective that's going to be in terms of being a deterrent. And then again, they changed the name from FGC, female circumcision at the time, to FGM. In terms of what the law actually says, it's an offense to commit FGM. It's an offense to aid, abet, counsel, or procure a girl to commit FGM for herself. And again, it's an offense for anyone in the UK to aid, somebody from outside to carry out the practice within the UK. But you will note that the law applies to UK nationals and UK residents only. And any act done outside the UK by a UK national or resident. So clearly, the law has a lot of challenges, even within this new law. The law also states categorically that some form of genital modifications can be done, provided it's done for medical and emotional purposes. So clearly, designer vaginas, as we saw when we went to the restaurant yesterday, the labiaplasty, is very much okay, and it can be done within the confines of the law, provided a medical person says that it's okay. Now, if a woman who has had FGM decides to ask a doctor to be sewn up, now that is not for mental well-being, because that's a cultural practice. Now, it's very difficult to tell the women we're working with at the community level to say how a 19 or 20-year-old girl can make a decision to have labiaplasty, and a 25 or 30-year-old woman can't ask to be sewn back up again. So within the law itself, there are a lot of challenges. And over again, we have to defend the law and say that one is actually out of choice and the other is not choice. Very difficult to hold when it comes to women tearing apart this decision. So in terms of the law itself, it means that if you are not a UK citizen, it's okay. If you're a student and you're temporary resident in the UK, it's very okay to take your child out and have FGM done and brought back into the country. Such that when they found a Malaysian student who had said categorically that her 2-year-old girl who had been born in the UK had been taken to Malaysia for FGM to be done, she could not be prosecuted, because she is not a UK citizen and she's not a UK permanent resident. Such that the social worker calls me to tell me that this woman has had another baby who is a baby girl, and they're very scared that she's going to have FGM done. You can't do anything about it, because she is not a permanent resident. So the law means that some people are protected and other people are not protected within the confines of the law, those who are resident in the UK. Whereas in a place like France, if you're a resident, you cannot have FGM done provided you're a resident in the country. Whether you're temporary or permanent, it applies to those who are resident in the country. So again, the law itself, in terms of really looking at laws and legal position, we need to be clear how to protect other people. Such that we had a case in the UK where a Nigerian resident had applied when he was going on leave that he wanted to have a longer stay in Nigeria because his daughter was going to be circumcised. Of course, it sent alarm bells ringing. And what did we have? We had the HR department ringing the police, telling the police, we have a young man here who is threatening to have his daughter done. So they went and arrested the man. They arrested him and his wife, etc. What did they find? They were undocumented migrants. Oh, so you're actually not a resident. You actually don't have papers. So what do? We deport you and your children. So what did it mean that that child was not protected? But if that child had been a permanent resident or she had been a national, the story would have been different. Now, for us to say that FGM is a human rights violation, and it's a human rights violation whether you're blue, green, or red, why should we differentiate between girls who are at risk and say it's okay for that girl to be taken back to Africa to have FGM done, whether she wants it or not, because she is not a permanent resident? And at the same time, we realize that when it comes to asylum-related issues, we are very silent on whether to give that girl asylum based on risk of FGM in going back to her country of origin. So there are very interesting challenges when it comes to policy-related issues. Reviewing the policy situation in the UK, we have the London Safeguarding Children's Board, who have produced fantastic guidelines on FGM. We have had a cross-government coordinator who was in post from 2009 to 2011. As at March 2011, the post had been ended, and there hasn't been any plans for recruiting somebody in their position. We had a task force on FGM, which really made fantastic recommendations as to the health-related issues around FGM and the need to introduce guidelines on working with health personnel, working with health professionals, particularly pre-service training, such that people did have the qualifications and did have the knowledge around FGM. Now, when the new government came into post, they actually put aside this report, and as a result of that, we are really not sure where we are on this fantastic set of guidelines and recommendations for moving forward on FGM. There has been a new cross-government violence against women and girls action plan, and evidence from the quote I gave from the government minister. UK government has launched multi-agency guidelines, very fantastic multi-agency guidelines, which actually provides guidance for a range of statutory agencies, the police, social services, health personnel, as well as schools, etc. The reality is that 1,000 copies of this have been printed. So I've just brought one copy to share with somebody here. Now, to tell me that 1,000 copies have been printed, to what extent are people going to access this in order to use? There isn't any plan as to how this is going to be rolled out. There is no plan as to how to train professionals to be able to have access and understand the procedures and how to use it. And clearly, this is going to be evaluated at the end of the year, and I would love to be there to see what is going to be done. Because at the end of the day, even where professionals have access to maybe half-day training, it doesn't necessarily mean that they are well equipped to take action when they come across somebody who has had FGM. So we are in a situation that we've got fantastic guidelines, and yet there isn't any strategy for implementing it and making sure that it's operationalized. Again, this government action plan, it supports community engagement work to tackle FGM, and it also reviews the effectiveness of the multi-agency guidelines after a year, as I said. There is a new plan to produce guidelines for prosecutors. Now, the situation with FGM is that even within the law itself, before somebody can be prosecuted, there needs to be evidence. Now, how do you determine whether that person that you are examining had FGM done 5 years ago, 3 years ago, or 1 year ago? It's very difficult to get that evidence to use in court. There is also the fact that their case must be reported, and I don't see how any 10-year-old girl is going to report her parents and say that she was sent home to have FGM done. So technically, it's very, very difficult to prosecute people who are found to have taken their children outside for FGM purposes. So again, for me, the most important focus around this issue is very much about ensuring that communities themselves have access and are able to police themselves effectively. And how do we reach communities is very much the issue that we need to take on board. And also to ensure that women have access to the information and communities have access. And to ensure that this is done, there needs to be resources. There's been no resource allocation or targets. Even though the FGM work is put within the broader violence against women strategy, £28 million have been allocated for domestic violence work. And then we find that £10 million have been allocated for rape crisis. Not 1 million. Nothing has been allocated for work on FGM. So clearly, what the evidence tells me is that it's okay to use this as a policy position on FGM, but it's not okay to allocate resources to ensure that FGM work is effectively implemented. And because FGM is almost always used as a very sensational issue, We talk about it and we drop it. So yes, we're making progress, but at the same time, we've achieved FGM being part of the wider violence against women strategy. But we have lost in terms of targets and in terms of a focus issue on moving FGM forward within the UK. I won't really spend much on this, but what I want to show is the whole multi-agency guide. And what it does is that it provides basic information, it provides very good practice guidelines, the website address gives you everything that you can access, but again, it doesn't address protocols for non-UK citizens and how to deal with them. It doesn't provide a dissemination plan, and again, as I've said, it doesn't have resources and targets. The UK legal and safeguarding policy, the government has an obligation really to respect, protect, and fulfill the rights of women and girls at risk of FGM. And over again, we hear it said at different policy forums, FGM is against the law, FGM is a human rights violation. We all agree it is a human rights violation. But when it comes to how do you fulfill and how do you ensure that this human rights violation is actually upheld, then there are a lot of challenges that I think we can hold the government accountable to. There is lack of government coordination, and I think that the most important thing around FGM work is that you do need a champion. And without having a champion, you would ensure that nothing happens. So it's very important to have a champion in this area of work. And without a champion, and it's so shameful that we actually lost the government coordinator, and because we've lost that government coordinator, we don't even have a space to really talk about these issues. The other aspect that I want to talk about, again, prosecution. There's been no prosecutions to date. In France, there have been about 30 prosecutions. And again, in France, the prosecution tool was such that they actually had a woman who was based in France, an exciser who was providing the service. And as a result of surveillance operations, she was then caught, and the investigation led to her being prosecuted. The good thing with France too is that even girls who have been found to have been violated or taken home for FGM, they also compensated. And so you'll find that there is a stronger push for communities to talk about it. There is a stronger push for people to report that they've actually had to undergo FGM. And the interesting thing too with France is that 2 babies died from FGM. There is also the issue of compulsory examinations of children, such that between the ages of 0 and 8 years, children would automatically have to go to the mother and child clinics, irrespective of whether you are from a practicing community or not, or whether you're a girl or a boy, you have to automatically go for the normal yearly screenings. And so as a result of that, if a child is found to have had a FGM, that child is automatically reported. So that has also resulted in quite a number of prosecutions in France. And so the situation in France is totally different from the UK. So it's quite interesting to see how implementation of policies actually makes it more effective to address FGM. But interesting enough, again, of course, communities are very, very strategic and innovative when it comes to what they want. And so what the government is doing in France is that they're not really working directly with communities. So they wait till the children are 12 years, sent back home to have FGM done. Who will know? Who will examine? So again, it comes back to even where there are policies and very good, you'll tend to find that without engaging communities to understand and drop the practice, people will find different ways of making the practice real. This is a quote from the studies we did in London. It says, if there were examples of people having been penalized here in the UK, or seeing and examining the daughters from each of the different cultures here, from different communities, that will really change things a lot. One message in the community will change matters. The law is not clear. Even those who have heard of it do not know what it actually means for the families. So again, there isn't a system of showing communities what the law really means. All opportunities are lost, particularly when women deliver and no information is handed to them as to the law, the legal implications, and support. And we would really prefer that those protocols are in place such that if a woman delivers, automatically there is support. She's signposted. A health visitor who takes over also goes home to examine her surroundings and make sure that she's in a position to protect her daughter. That doesn't happen. Guidance for health professionals. We have quite a lot of guidance for UK in terms of health professionals. The British Medical Association has guidance. The Royal College of Midwives has guidance. Royal College of Nursing and the Royal College of Obstetrics and Gynecologists. The Green Top guidelines are very, very useful in terms of providing guidance. But again, this doesn't go along with wide-scale training. So again, it's very, very difficult. We have the procedures, etc. in place. There isn't any systematic effort to roll out training. Some of the barriers that I want to talk about in terms of implementing existing laws is that frontline professionals clearly are unaware of FGM. And in a study that was done by the Department of Health, which was a snapshot study, it actually showed that those who were willing and able to take action when they came across somebody who had been affected by FGM were those who had had some training. So again, training does make a difference. Training does increase awareness and increase people's confidence and skills to be able to deal with women and girls when they come across. Where there are no standards of care or protocols in place, it becomes really, really difficult. And again, we really don't have systematic, accountability at local authority level. And so it's very ad hoc. You'll find that some local authorities are really going ahead, putting in systems to actually support FGM. We've got certain systems, particularly around those who set up FGM steering groups, etc. But the reality is that it's still very ad hoc. And we don't have any systematic data collection system. So you'll find that in a lot of cases, they'll tell us, there isn't evidence. We really don't know that FGM is an issue. And so without evidence, again, it means that you can't plan without the evidence. It's not easy to go to health professionals with problems on circumcision, as they might have no understanding of the issue. And this was a quote from the study we did from the peer research. This is a bit too much, and I wouldn't want you to look at it. But again, one process that we can really use is when governments report to the Committee on the Elimination of All Forms of Discrimination Against Women. And when the UK government reported in, I think, 2008, the recommendations were that they needed to take strategic action on FGM, particularly full implementation of legislation, and also to expand training. Now, I know that the UK government has to report in, I think, 2012. And so it's really, really interesting. They are now preparing the report towards that. And as a result of that, I'm sure this is going to really feature in it and how they have developed this. But again, it's very important for us to also provide evidence to CEDAW as to what the government is doing. So we do have, in terms of civil society action, to be able to also develop processes which will inform decision making. I'm talking about some of the new policy challenges because of new, again, government changes. The NHS, which is the National Health Service, the commissioning changes has actually meant that it's going to really affect FGM specialist services. We have FGM specialist services. We have about 16 in the country. 10 of them are actually in London. But again, without a consolidated framework for these specialist services, we'll find that as individuals who are passionate and very committed to these services move away, we don't have people coming into these services. To date, I know that the Waltham Forest, which was supporting a very wide population in that area, the service has stopped or closed because the staff have left. In the same way, Birmingham, we've had two very good nurses who actually led on the service. One has got a new job and the other person has not been replaced. So we are finding a situation where even the policy framework doesn't support existing services that we have. The government's commitment to gender equality is also very contentious. There was a very good accredited master's module on FGM, which is led by King's College in partnership with Guy's and St. Thomas's. It has been cancelled due to funding. And this is a very strategic course that also provides not only theory issues around FGM, but very practical clinical experience for new professionals to be able to address FGM. So Forward's role basically in informing the policy, we've been very instrumental in supporting the 2000 parliamentary hearing. We've provided evidence a lot to the government in terms of policy making, and quite pleased to realize that quite a lot of our study quotes are quoted in the report on the government multi-agency guide. We also provide resources, particularly in terms of the specialist services and information, and we're a member of the UK task force. One of the things that I want to share is some of the resources that we produced, and this was a poster that we did, which was then adopted by the police and widely used. In terms of my way forward here, we have been part of the European FGM campaign, which is a network of 12 European partners. And one of the campaign demands is really about policy-related issues and to make strategic impact at the European level on policy. And the 5 areas that we actually are pushing for within the policy is to address the health needs of women and girls, irrespective of their status, particularly those who are residents in the country, to look at data collection methods and to try and use them rigorously such that it would inform policy making, to actually integrate FGM as part of violence against women in a meaningful way and not just in a tokenistic way as we've had, and to really look at the issues of asylum, because asylum is a big, what would I say, what, is it a big elephant in the room or a big whatever, and yet nobody sees it, you know. And so how do we address issues around asylum? And finally, how do we address developing cooperation? To what extent is government in a position to address development assistance targeting FGM in countries of origin to ensure that FGM is not only tackled as a European issue, but is also tackled more as a development issue? And in terms of an agenda for action that I'd like to end with, we really feel that it's important to have government coordination of policy implementation, provision of an enabling environment for training, and not just ad hoc one-time training, but a systematic process of training for policymakers, but also for statutory agents. A system for data collection and analysis, and not just data collection and not analyzing them, because very often we do have some data being collected, but nobody is using them, nobody is analyzing them. We want to have more long-term and sustainable outreach and community engagement, and better clarity on safeguarding protocols such that those who are non-citizens also will be equally protected. And the need for a policy on community engagement. To date, I haven't seen any policy on community engagement such that it actually makes it very difficult to operate effectively. And it's like, okay, community level, you can do what you want. We don't need to have any interventions. We don't need to have any community policy within that level. But I think it's very strategic that we have a community engagement policy. And we need to have a commitment throughout for resource development and to support. So, many thanks. Merci and asante sana. Thank you.